Thank you for visiting ltcshop.com. Long-term care insurance, what you need to know. First of all, what is long-term care? Long-term care is many things to many people, but the biggest thing you need to remember is that it is a problem. It is a huge problem, and a problem that is coming for you personally or someone you know. If it's not a problem now, then it'll probably be a problem for you in the future. But why is it such a problem? Well, because it costs so much. Genworth does this great study every year where they analyze the average costs. And the average cost of home health care across the country is $150 a day. Assisted living is around $141 a day. And a nursing home is about $290 a day. Well, that's great, but what about our area here in Washington? In the Puget Sound area, the home health care average cost is $150 a day, while assisted living is about $213 a day. $200 a day, and the nursing home is $350 to $400 a day. So it's significantly higher than the nationwide average here in our area. But the question is, does insurance work? Because we know long-term care insurance, but does it work? Well, let's look at the numbers. The NAIC publishes the report in 2019, and a total of almost $13 billion was paid out in 2019 across the country. That's about 285,000 claims. Comes down to $124 per day is the average claim amount. But as we saw, even home health care costs $213 a day, up to $400 a day for nursing homes. So the industry standard or the nationwide average is significantly different. But who are the people that are making these claims? There's a 69% chance of needing care if you're over the age of 65. So most of the claims are by people that are over age 65. Who's the largest payer of long-term care total? So it was almost 13 billion of private insurance long-term care claims. But who's the largest payer? It's Medicaid. And look at this. This number is from 2017. And in total, it was $235 billion were paid out for long-term care. It is a huge $235 billion problem. And you could see that private long-term care insurance was only accounted for 4% of that. So in 2017, it was only $9.4 billion. And now in 2019, that it grew to a $13 billion problem. So it is an absolutely huge problem that is breaking the bank of our government and individually our pocketbook. It's going through our wealth for our family that we've amassed. And so that's the biggest thing you need to remember. But Medicaid, let's just real quick, what is Medicaid? It is primarily a health coverage for low-income adults, and it's administered by the states according to the federal guidelines, and it's funded jointly by states and the federal government. You need to know that there are income and asset limits. If you ever need to go on Medicaid to pay for long-term care, there's what they call spend down rules. We're not going to go into it. You just need to know that it exists. And this is why if you have income and assets to protect, you need to ask yourself this question: how much of your net worth do you want to protect for your spouse or your heirs? Well, the state of Washington is the first in this country to try and address this problem. They passed the Washington Long-Term Care Trust Act in July of 2019 in an attempt to decrease the Medicaid budget. It is a payroll tax that is 0.58% or 58 cents for every $100 of your earning. And this tax, it begins January 1st of 2022. Now, it'll take 10 years to be fully vested and to be able to receive benefits for long-term care. You have to pay without a break for 5 consecutive years, or you have to pay your tax for 3 of the last 6 years from the date of application of benefits. So I've read some articles where people think that you're fully vested after 5 years or fully vested after 3 years, and that's just not the case. That is only if you go on claim. If you need long-term care, you have to have paid 3 of the last 6 years. without a break for 5 consecutive years. So the 10 years, that's where if you're headed toward retirement right now and you're still earning wages, you get a W-2 and you're age 62 and you're planning to retire in 3 years, you'll pay the tax for 3 years. And unless you file a claim within 6 years, then you won't ever receive benefits for this because you have to pay into it for 10 years to be fully vested. It does not cover people already retired, and it doesn't travel with you. So if you retire, if you work for 15 years and you pay this tax for 15 years, and then you want to retire in the state of Tennessee or Florida or Arizona, anywhere else, it will not travel with you. You will not be able to use the benefits. What else do you need to know? The benefits are paid in $100 units. Essentially, that means $100 a day for 1 year. So it's $36,500 lifetime maximum. That's what you get for this tax. To qualify to go on claim for this, you need help with 3 of the 10 ADLs. Now, the 10 ADLs are consistent with Medicaid. So it's medication management, personal hygiene, eating, toileting, transferring, body care, bathing, mobility, dressing, or cognitive impairment. You need help with 3 of the 10. Traditional long-term care insurance, it's 2 ADLs of 6. So there's a little bit different rules there. There's no guarantee that your payroll tax will remain fixed, that it won't be increased. And just something to note that 45% of Washington residents could receive comparable coverage on the private market for equal or less money. Some important dates you need to know. I already mentioned that the tax starts January 1st of 2022. As the law was written and signed into law, there's an exemption allowed for people who already own long-term care insurance. December 31st, 2022, as long as you own a policy before that date, you'll be able to opt out of the tax. However, this House passed an amendment that changed the exemption date, but the Senate did an amendment changing that date to November 1st, 2021, this year. And chances are very high that the House will vote on the Senate's version and it will remain November 1st, 2022. So you have between now and November 1st, 2021, to own a long-term care insurance policy. You'll be able to apply for an exemption and opt out of that tax. But you must own a policy before that date. So that's a very important date to remember. But what's the solution? What can you do? How do you get a policy? Well, we can help. We have the best solution for you. LTCshop.com. We are independent brokers and we represent all the top companies, and we can help you shop and compare for the best policy for your situation. We have a great policy. We call it a recovery care policy or a simplified issue long-term care insurance policy. This is primarily geared for employees that are age 50 to 79. And that's for this specific policy, age 50 to 79. If you're an employee, we have this policy for you that you simply just answer health questions. There's no telephone interview, and they don't even pull medical records. If you can answer no to the health questions, you qualify. So if you are in this age group, especially if you're age 58 to 68 there and you're working still and you're being paid wages and the tax will apply to you, you may not work for 10 full years. If you're planning to retire within 10 years, you really need to look at something. And the difference with this, you are fully vested from day one. The state plan, it takes 10 full years to be fully vested. You buy a private policy, you're fully vested from day one. It's portable. You can use the benefits anywhere in the United States or Canada, so you don't have to stay in the state of Washington after you retire. There's a 15-day elimination period, meaning you pay for care yourself for 15 days. We don't know what the state's plan will be. They're still finalizing details like that. Most traditional policies, there's like an average of 90 days that you pay it for an elimination period. But this policy, that simplified issue, is a 15-day elimination period. And it really helps you get into a better facility. Facilities that take Medicaid directly from day one typically have a wait list. And there's other facilities that don't take Medicaid from day one. Those don't typically have a wait list, but they're going to want to see the private pay, which is either cash out of pocket or you have an insurance policy. Here's a simple chart that shows the tax. If you're earning $100,000, your monthly tax will be $48. And let's just say, sorry about that, you're a female, age 50. Costs you $37 a month for the simplified issue. If you're earning $100,000 and you're female, age 50, well, you're better off buying a private policy. So we can help people under age 50 as well. So even though this plan that I was talking about is for people over age 50, we can still help you if you're under age 50. We can help you if you're under age 40 even, which is typically, people under age 40 typically aren't even looking at long-term care insurance yet. But with this tax, it's time to start looking at it. And we can even help people under age 30. There's very few companies that will insure people under age 30, and we represent them as well. So we can help you with that. So I thank you very much for watching, and click on the links on this page to learn more, or fill out the form and we'll be glad to send you some quotes. Thanks.